I welcome everybody to the Thursday Pivot. Today, it is my pleasure to have Jim Viccars on as our guest. I'm a group benefit specialist, as everybody knows, and my job is to work with employers in putting together employee group benefit plans. That means access to care when you need it as expected on your benefit plan, and being able to run those claims through. But what happens when there is a need, when there is an emergency health situation? Well, not emergency that you're going to go to the hospital emergency room, but an urgent care situation, and you have to be like that person who's looking for a colonoscopy and be months and months down the road. Jim, take us through a little bit about what you do, how you came to do it, and then answer that question on the months and months of waiting.
The MyCare programs were started in 2012. On that, originally we focused the entire program on the Mayo Clinic, right? So we had an exclusive contract with Mayo Clinic, and everything came about. The program was actually started because a friend of the family became quite ill. He was a wealthy person from southern Saskatchewan. He waited 9 months to get a diagnosis, which he never received. In the meantime, he went from 260 pounds down to 160 pounds. On that, he eventually, we tried to convince him to go to the US, to Mayo Clinic for services, but he was a true Canadian and he refused to do that until he became so sick that his brother-in-law and a friend put him in a car and drove him overland to Rochester, Minnesota. But he died in his hotel room the night before he was going to be assessed at Mayo Clinic. Of course, because he passed away in a hotel room, they had an autopsy, and he found a very difficult to diagnose cancer in the upper bowel region that, because Canada didn't have, or at least Saskatchewan and Alberta didn't have the right equipment, or they were waiting until, in his case, it was nuclear medicine, until they could get 2 patients so they didn't waste the $6,000 isotope on 1 patient. They just let him basically pass. So we thought we could do something about it, my wife and I. And so because I had a relationship with Mayo Clinic as well as with Lloyd's of London from my previous business in the oil business, I put together the MyCare programs, the first MyCare programs, and we had Mayo Clinic exclusively as our provider in the U.S. It's a wonderful system, but at Mayo Clinic. But over the years, we had a lot of requests from agents and brokers to expand that. So as of last March, we've now ended the exclusive relationship with Mayo Clinic and expanded the programs to include other providers in the U.S. The U.S. is far more advanced in different treatments and diagnostic situations. Canada often picks up on those. We have excellent doctors. Depending on where you are, we have some very good facilities, but often it's a difficult time getting into those facilities and to coordinate things. Now, full disclosure here, Phil Tyson is now provides our insurance component through his syndicates well, they're based out of England. But so Phil and I have been working together for a number of years on that, and so he's been intimately involved. We put together a group benefit program that provides access to, we're talking about serious illness here. So serious illness can be defined as something that requires people to be hospitalized either for surgery or for treatment. Right? So normally we see a lot of oncology, we see a lot of cardiology, and major orthopedics. Those often have extremely long wait lists in the public system. We were talking about, Bob was mentioning he was able to get an appointment in 3 weeks. And of course, it depends on what and where you are. And a good point here is, for instance, colonoscopies. Colonoscopies in Edmonton have wait times as much as 3 years on that. In Calgary, because of the Forzani McPhail Center, you can get one in certainly less than 3 months. So, that's the differences that you see just in Alberta. When you go across Canada, you see major differences in that. And you have major differences in equipment, major differences in processes, major differences in physicians. All of these things add up often to long wait times. So we wanted to put a program in place that got people access to, when they were threatened with a serious illness, to at least a complete diagnosis. We have a second opinion component to the program, but second opinions are relatively, a small part of the business. The group benefit product actually helps people get a diagnosis when they're waiting. So we gather the medical files at our clinic in Vancouver. We have them assessed by our physicians. If there is some difficulties in, and there often is, in scans or things that are out of date, then we bring them up to date. We pay for an MRI or CT scan. Normally it's MRI on that, but to soft tissue issues, except sometimes with heart on that. So that is all then gathered into a complete medical file, and then it's sent to a U.S. Center of Excellence. As I said, we used to use Mayo Clinic exclusively, but now we use a whole plethora of different medical centers, depending on where we feel would be the best area to get a diagnosis and treatment plan. So they would review what the treatment plans are in Canada. They would review that the diagnosis is correct. They would make suggestions. We work collaboratively with the Canadian physicians on that. So that's all part of the group benefit program, what we call our health benefit option. So it's everything from a second opinion to assistance in complex diagnosis on that. Over and above that, and this is where Phil comes in, we have an insurance product on that. That's called MyCare Advantage, or simply the MyCare Insurance Program. Basically, it's bought by professionals, business owners, things along that line. It's not overly expensive, but we find that most Canadians think that they're going to get, if there's a serious illness, they're going to get treatment in Canada on that. And eventually they will. It's just, will it be in time? Will it be appropriate? Will it be the latest technology? And all of those things. And again, that's completely dependent on where you live. So Bob's in Vancouver. They have an excellent cancer center there. The wait lists are long on that, but you get into the cancer center, the BC Cancer Center, once you're into it, it is an excellent facility. But normally you don't see people in the BC Cancer Center unless they're at stage 3 or stage 4 cancer. Crisis medicine is what we call it. It's what the doctors call it often. If you go to places in Saskatchewan, Manitoba, and Ontario, outside of the major centers, you are likely not even going to get a diagnosis until you're stage 3 or stage 4. So in which case it becomes often too late on that. So unfortunately, the government keeps no statistics on that. So you cannot find statistics. In the US, of course, everything is statistics because they have litigation issues down there if they don't provide quality treatment. So over the years of the MyCare programs, we've on the insurance side, we provide a $50,000 diagnosis situation. So someone that can't get a diagnosis in Canada has the policy, they can be sent to a center of excellence in the US, get their diagnosis and treatment plan, and then they can either bring it back to Canada, or there's $1 million US in coverage for treatment at this particular facility in the United States. So those are the two basic programs. So one is for employees, it costs $3 to $4 a month per employee, depending on the number of employees on it. And then the MyCare program, the insurance product, is approximately, it's age dependent. There's no medical requirement on that. Of course, there is a pre-existing condition clause, but there is a situation for about $300 a month per person. And again, it's age related. It goes up to age 80 on that, so that the coverage can follow people into retirement as well as program. We have one additional program called MyCare Assist, because we get a lot of calls, I had 4 of them yesterday from people who already have a serious illness condition and can't get services in the way, or they're not getting the services they feel in Canada. We have a MyCare Assist program, and that basically is a complete compilation of the medical file and then transference of that to a U.S. Center of Excellence on that. And we then will get them a cost analysis of what it would cost to get their services. First, they get confirmation of what their treatment is, if it's appropriate. We have several of these ongoing right now on that, and then they get a cost to pay out of pocket for services in the United States on that. So again, at a center. And when I say Center of Excellence, there is dozens of places that you may have heard of: Cleveland Clinic, Mayo Clinic, John Hopkins, Henry Ford in Detroit, Seattle, St. Mary's in Seattle, it's Providence Healthcare in that, UCLA, Stanford, Rice University in Texas, Eisenhower in Palm Springs. There's just a tremendous number. MD Anderson, Memorial Sloan Kettering in New York, Jupiter Healthcare in Jupiter, Florida. There's just a tremendous number of very innovative and excellent centers down there who have the latest technology, the latest treatment protocols, and can provide excellent service. It's not inexpensive, but it is something else. Without the insurance policy, often it can cost up to $200,000 for treatment, and sometimes much higher depending on the complexity of the issues. But the services are outstanding on that. So anyway, those are the basic 3 programs, but the 2 that we concentrate on are our health benefit option for employees and our insurance product advantage for the professional business owner category. Those are people that normally buy the upgrade.
Well, my mind spins a little bit here with a number of questions for you, Jim.
Sure.
So let's start with what we face as from the group benefit side of things and what we hear. So one, I'm always astounded that we as Canadians put up with such waiting periods.
Right.
Like, such long wait times seems astronomical. I'm going to pull you into the conversation in just a minute, Phil, with regards to somebody who is going for care and what that means. But my first thought here is, in benefits there and in coverage, provincial coverage, however you see it, there seems to be that scaling back. We know you have an illness, but we want to give you that least costing procedure, drug, opportunity. And by the time you get something that is going to work, it may have worked when you first started, but now it's too late. Why have we evolved this way?
Well, first of all, you're right about one. The important part there is early intervention. The earlier you can determine that you have a serious illness and treatment can begin, then those are your best chances of recovery. Secondly, there is no reason for wait lists. The wait lists are a product of the system. They were not intended, the system was not intended to do that, but the 4 groups that control healthcare, right, find that wait lists are convenient because it helps them to budget. So the groups that control healthcare are the politicians, which have the most responsibility and the least power. The bureaucracy, senior bureaucracy, who manages the system on that has no incentive to it. And these are very high paid jobs. And you would not believe how many, there is thousands and thousands of these people that make several $100,000 a year in payment. And if you ever looked into it, it would sicken you as to what is paid out to manage the system on that. And they basically see no reason to fight. They don't care what the politicians say, because they know politicians change every few years, right? So they're there for life. They come out of university, they get a job in the bureaucracy, they work their way up, and then they retire on very heavy pensions. And so it's a very, very closed system there. They don't allow any anybody to disrupt that system at all. Then you have the unionized healthcare, and delivery in Canada is always through the union. All right, the unions control delivery. It's the period, the part of the healthcare system that works the worst, but it controls the actual delivery of it. And so they have no incentive to allow any competition or anybody else to get into it. So Foothills Hospital in Calgary has 52 unions. So the bureaucracy spends most of its time. Some of these unions have 3 or 4 members, right? Others have thousands on that. But you also have to remember that the bureaucracy on the Alberta Health side is also unionized, right? And so they have no incentive again. And with the last government, they hired 10,000 more bureaucrats. It's happening in BC right now because they have an NDP government. They're hiring bureaucrats by the thousand. They have no incentive to do anything different. And as a matter of fact, they're de-incentivized if they do that. Then the last group that controls healthcare is major corporations. Everything in the healthcare, and the largest budgets in Canada are healthcare. And they build everything in the system, from the buildings to the floor waxes to the oxygen to the gowns to the needles, are bought from private corporations, usually major corporations. Beds, linens, you name it, everything. Even the food services are bought from private corporations. And so they have no incentive to do anything different on that. None of these groups are evil, but you're talking about in Alberta, 20 some odd $billion budget, and you have major corporations such as TELUS, who provides communications and computer systems. You have, people that provide beds. It's an amazing how much of this budget is got out. And so they spend much of their time wooing bureaucrats, the senior bureaucracy, taking them on trips, doing this type of thing. And so there's no incentive. The patient has really, you get what you get, and you get it when they said. Now, the doctors have no say in this. The doctors, unless they're bureaucrats.
And quite frankly, we've been fed, that we have the best system in the world, that we have access where other people don't have access. Well, you know what? I have access. I'm sure that if I have a bullet and I need to go to emergency, they're going to look at me right away. Right. But, these days, I'm not so sure. They may just make me wait outside of -35. Who knows?
Right. And, colonoscopy is a good example with the 3+ year waiting lists in Edmonton on that. It was, again, private industry that put the money up for the McPhail Fresani Center in Calgary for that specific person, because several of their people ended up with colon cancer, and so they put up the money for the colonoscopy. They put it into a trust. And so you find a lot of that private money goes into it, but it's specific to a particular situation. We have excellent medical schools. We have excellent doctors. The nurses, for the most part, are very good on that, but they can only work within what they're given, right? And if they're innovative doctors, one of our chief medical officer for MyCare is Dr. Tarawala, right? Raj is a graduate of the University of Calgary Medical School. If somebody's from Calgary, they may have known his father, who was an ophthalmologist in Calgary for 45 years and retired a few years ago. But Raj is absolutely brilliant. He has a PhD in biomedical engineering. He has a fellowship in nuclear medicine. He's a world-renowned radiologist. He does not work within the system, right? He built an MRI machine. He bought it for his company's called AIM Medical Imaging in Vancouver. He built a machine, a Siemens machine, and ended up, he and his technician, going to Germany to teach Siemens how to build a proper MRI. And their MRIs are all over the world. He's absolutely brilliant, but they won't allow him to work in the public system. They won't pay for it, but his full body imaging is the best that there is. He's all over the place. At Northwestern University, Memorial Sloan Kettering have bought his machine. And a company in California is now financing it, so they can put these machines all over, but they can find cancers at an early stage. And what he was told, and this is a good thing, the BC Cancer Center, as I said, is excellent, but the bureaucrats in charge told him when he applied for his code that they didn't want him to do this, because every time he found a cancer in early stage, they had to treat it, and that screwed up their budgeting. And so they refused to give him a code. So he does it privately. We have an agreement with him. Our clinic is based in their office. But it's an incredible technology. And we always encourage people to go out and have a full body MRI scan. It's incredible what the technology can do. So these things, anyway, we're very critical of the Canadian healthcare system, but not the people that work in it.
No, and I think that's an important point to make. You're not talking about the frontline, first line workers that are there doing their jobs. You're talking about the behind the scenes with the strings and creating these ungodly schedules. Phil, what does it mean when if somebody was going to go across to one of the clinics? Now, it's a medical issue. So how does that work with coverage for having them travel if something else happens? So I get off the plane, I want to go to Johns Hopkins, I am in the taxi gets into a wreck. Am I covered?
Well, again, that's not something that would typically be covered under the MyCare Advantage program.
No, but that's what I'm saying. This is where these two collide, really.
Like travel insurance, it's predicated on a pre-existing condition. So, that's an unforeseen accident. So if somebody had bought travel insurance or has a group insurance policy that has out of province benefits, those are the benefits that would kick in on that.
Because they were going across for a medical situation, though, would they still be covered?
Yeah, I mean, there's no definition of why you're going down to a large degree to the United States. I mean, the travel policy doesn't say you're going to be excluded if you're traveling from X, Y, and Z. It's just going to tell you, essentially, if you've got a pre-existing medical condition, we're not going to allow you to travel down there to receive treatment for that specific condition. So essentially, we've already determined that this is an eligible claim under the Advantage program. It's going down there. It's been already set up. It's been pre-approved because the underwriters work with Jim and his team closely to make sure that, okay, if we're sending Phil down there, we know it's eligible under the policy. We know what we're going for. We know what the estimated costs are going to be. That's all taken care of. So now you're introducing.
And that's really what I wanted to clarify, Phil, was that there is that availability that somebody wasn't going and getting the MyCare treatment and getting the services that they need, but then leave themselves at risk for something else. That's really what I wanted to make sure that people understand.
Who is going down to the U.S., regardless of whether he's going down there for a pre-approved medical procedure, should still buy his travel insurance. You still can have accidents and unforeseen illnesses completely unrelated to what you're going down there for.
Right. Can I add one thing to that?
Absolutely.
And this may be the point that you're bringing out. If you have a corporate benefit travel component to your insurance, check with your insurance company first. Some of them exclude coverage on your travel if you're going for medical conditions. So whenever somebody is going on one of our programs, we tell them to check their travel insurance and make sure that those unforeseen things, because there is a number of companies who exclude on their travel insurance policy. If you're traveling outside the country for medical services, they won't cover you on your travel insurance. So, check on that first.
Oh, absolutely. But by and large, in the case of an accident, that's an unforeseen accident. Right. Nothing that I've ever seen in a travel policy that would exclude that specific incident, regardless of the reason.
Actually, Phil, there is. You have to be careful. There are some
policies. Well, I'm sure there are some. I just I haven't seen one.
Right.
But I'm sure that I agree with you, Jim. I'm sure there are policies out there. Right. But everybody should. You should not just rely on not having insurance. If you're going down there, pre-approved treatment that we've approved under this program doesn't kind of alleviate you from ensuring that you're protected for other issues. while you're down.
And to Karen's point, has said the same thing. So I'm with you, Karen. So I think the point that we're trying to make is that if we're accessing the MyCare, Advantage or the MyCare program, I think it's important then to have that conversation with Phil as well, to say that, okay, I'm going to now do that. I think that they have to work in conjunction. And that's all I'm saying is that somebody shouldn't be relying on just picking up the phone and calling Allianz and saying, hey, I need travel coverage, because they are a pre-existing condition. And nor should they rely on their group benefit plan, because this is a very specific. I would rather whomever is listening to this to say, if I'm going to access MyCare, to also make sure that I have talked to Phil with regards to the travel.
As our the Advantage program, it's all set up before you even leave the front door.
Okay.
So that specific condition is already pre-approved. There is no doubt that you're going down there. There is no doubt that the policy is responding.
Right.
Perfect.
But the other side, yeah, you can't get away from that. Anytime you leave Canada, and some respects your own province, you still need to take care of unforeseen medical options.
Right.
Yeah, and that's the point. That's the point I wanted to make, Phil, so that somebody listening to this wasn't misunderstanding what we were going to do. That brings us to time. Any questions, Bob, Tim, Karen? You can throw it up there if you have a question. I'm watching the chat bar. No? Any last words, Jim, as we finalize this? And I thank you so much for coming out and
Sure.
sharing this information today.
A warning, I guess, right now out. As you're probably aware, with this COVID situation, the debt that the governments are running have been astronomical. And 2 weeks ago, the premiers of all the provinces and the leaders of all the territories asked the federal government to increase their payments for healthcare from 22% of the load to 35%. That was an indication to all of us in the business and to the bureaucracy and the rest of it that the money's gone. There is, and the federal government has no money. It's printing money like it's going out of style. What this is going to mean in the next year or two is a clampdown on services. The largest budgets for all the governments is healthcare. And if there's no additional money coming from the federal government, and they have no money on that, then there's going to have to be a clampdown on services. We're finally reaping the whirlwind that we have with these deficits over the years, and the largest budget is healthcare, and there's going to be cuts. There's already fights in Alberta with the doctors. Some doctors are leaving. So you have a situation, and that's mostly primary care physicians, but there are some specialties that are going to be affected by this. But you're going to have a clampdown. There is no other option here. You can't have 65% of your budget in healthcare and then have this massive debt situation. And the federal government is not going to be able to increase their participation because they're simply printing money now, the debt upon debt. So the first thing that's going to be hammered is going to be healthcare. Wait lists are going to get longer on that. The unions are not going to back off, and they're not going to accept layoffs and things. There's going to be, fights that make look like the fights that Klein had in the 90s, look like kid stuff. And the people that are going to be caught are the people with serious illness concerns. So, we're expanding our marketing because we know that this is going to be a true issue for every Canadian. And we're hoping that with more people in the poll, we can get more people help at U.S. facilities. So, because it's going to be necessary.
Thanks again for sharing this. Getting this information out is paramount for me, as people who know me well know. That's my motivation. So thanks, Jim, for coming out today. Thanks to everybody for attending. I appreciate you taking the time, and I hope that I'll see you back again soon. So until then, accept my virtual handshake.